Today we'll talk about the nose, mouth, and throat. These are vital passageways that allow gas exchange and food and fluid intake. The neck houses the lower portion of these passageways as well as part of the spinal cord. Because these structures are critical to basic functioning, they need careful examination. To help you do that, this program will show how to examine the nose, including the external nose, nasal cavity, and paranasal sinuses, the mouth, including the lips and oral structures, the throat, including the tonsils and pharynx, and the neck, including the lymph nodes, trachea, and thyroid gland. In this program, you'll see a healthy person with normal findings. In your own practice, you may detect the same normal findings, normal variations, or abnormal findings.
Before assessing the nose, mouth, throat, and neck, review their anatomy. The external nose includes the ala, the lateral outside wing, and the nares, which widen into the vestibule and are separated by the columella, which is continuous with the nasal septum. The lateral walls of each half of the nasal cavity contain three bony projections: the superior turbinate, middle turbinate, and inferior turbinate. These structures warm, filter, and humidify inhaled air. Two pairs of air-filled paranasal sinuses are accessible for examination. The frontal sinuses lie in the frontal bone above and medial to the eyes. The maxillary sinuses are in the maxilla, or cheekbone, along the sides of the nasal cavity. The major structures of the mouth include the lips, tongue, teeth, and gums, as well as the hard palate, soft palate, uvula, anterior pillars, posterior pillars, and posterior pharyngeal wall. The mouth contains three pairs of salivary glands: the parotid glands in front of the ear, the submandibular glands at the angle of the jaw, and the sublingual glands under the tongue. Behind the mouth and nose lies the throat, which contains the oropharynx with the tonsils and the nasopharynx. The neck has two pairs of muscles that serve as landmarks: the trapezius muscles and the sternomastoid muscles. They divide the neck into the anterior triangle and posterior triangle. Within the neck, the thyroid gland straddles the trachea. The gland's two lobes curve posteriorly under the sternomastoid muscle. Just above the thyroid isthmus is the cricoid cartilage, notched thyroid cartilage, and hyoid bone. The head and neck have a rich supply of lymph nodes, including the preauricular, posterior auricular, occipital, submental, submandibular, jugulodigastric, and superficial cervical nodes, as well as the deep cervical chain under the sternomastoid muscle, and the posterior cervical and supraclavicular nodes.
Okay, Tiffany, we're just going to do an exam of your nose. So
With the person sitting up straight, begin this part of the examination by inspecting the external nose.
Everything looks good.
The nose should be midline, symmetrical, and free of lesions or deformities.
Tiffany, now I'm just going to check for patency, so I'm going to put a finger over each nostril and ask you to breathe in, okay?
Next, test for nostril patency by pushing each one shut and having the person sniff in through the opposite nostril.
Very good.
Then examine the nasal cavity.
So I'm going to ask
To
you to
do
tilt your
this,
head back.
gently
I'm
lift
just gonna
up
put
the
my
tip
thumb
of
on
the
top of
nose
your nose and look
and
on the
insert
side,
the
okay?
lighted otoscope with a nasal speculum
can
into
tilt.
the vestibule. Avoid pressing on the sensitive nasal septum. With the person's head erect and then tilted back, inspect the nasal mucosa, septum, and turbinates. The mucosa should appear smooth, moist, and red, and should have no swelling, discharge, or bleeding.
All right, now the other
The
side.
septum should show no signs of bleeding, perforation, or significant deviation. The middle and inferior turbinates should match the color of the nasal mucosa and should have no polyps or swelling.
All right. Everything looks
To
good.
palpate the
Now I
paranasal
can feel my
sinuses,
thumbs pressing on
use your
face and let me
thumbs
know if you feel any
and
tension
press
at
over the
all.
frontal sinuses below the eyebrows, being careful
Anything?
not to press on the eyeballs.
Okay.
Then press over the maxillary sinuses below the cheekbones. Normally, palpation causes no tenderness.
Now I'd like to take a look inside your mouth.
Before this part of the examination, ask the person to remove any dentures. Then inspect her lips closely. After checking the outer surface, retract the lips and observe their inner surface. The lips should be pink, moist, and symmetrical, with no cracking or lesions. In a darkly pigmented person, the lips may normally appear bluish rather than pink. Next, use a pen light and tongue depressor to inspect the teeth and gums.
Inside, so just open wide.
The teeth should look white, straight, evenly spaced, and free of decay. The gums should look pink, with no redness or swelling, and should have a stippled surface with tight, well-defined margins.
Okay, now just bite down as if you're chewing, Tiffany.
Also, ask the person to bite down as if chewing,
Now look at the
so
other
you can
side.
check her jaw alignment. In the back of her mouth, the upper teeth should rest on the lower teeth. In the front, the upper incisors should slightly override the lower ones.
Okay, now open wide, Tiffany. Just need to look at your tongue.
Now check the tongue, which should be pink, even-colored, moist, and slightly rough on the dorsal surface. It may have a thin white coating.
Now touch your tongue to the roof of your mouth, please.
When the person touches her tongue to the roof of her mouth, its ventral surface should look smooth and shiny, show veins and saliva, and have no redness, nodules, or ulcers.
Okay.
Then, using your gloved hand, grasp the tongue with a gauze pad. Inspect its sides and base as you pull out gently and swing it to each side. You should see no lesions or white patches. In an older adult, the tongue looks smoother and the buccal mucosa appears thin and shiny.
Touch your tongue to the roof of your mouth, please.
Carefully inspect the U-shaped area under the tongue. If the person has mouth lesions, is over 50, or smokes or drinks alcohol, palpate it with one finger.
Feel around your gums.
Put your other hand under the jaw to capture abnormalities. You should feel no induration. Next, hold the cheek open with a tongue depressor and inspect the buccal mucosa. It normally appears pink, smooth, moist, and free of lesions. Stenson's duct may look like a small dimple across from the upper second molar. In a darkly pigmented person, the buccal mucosa may display patchy brown hyperpigmentation.
Now open wide and tilt your head back so I can look at the roof of your mouth.
Now shine your pen light up to the palate. The more anterior hard palate should appear white with irregular transverse rugae. The posterior soft palate usually is pinker and smooth and can move up and down. You may see a nodular bony ridge in the middle of the hard palate. This normal variation, called torus palatinus, is more common in Asians, Native Americans, and Inuits.
Okay, open wide again, please.
Observe the uvula, which should look like a fleshy pink pendant hanging in the midline. To test cranial nerve 10,
say ah.
the vagus nerve, have the person say ah. As she does this, you should see the soft palate and uvula rise in the midline.
Now I'd like to look at your tonsils, okay?
To inspect the person's throat, use a pen light and tongue depressor. Begin by observing the tonsils behind the anterior pillar. If the tonsils are present, grade their size using this scale. 1+ indicates that they are just visible. 2+ indicates that they protrude halfway between the pillars and uvula. 3+ indicates that they touch the uvula. And 4+ indicates that they touch each other. Normally, the tonsils should be pink and rough with many indentations. Have no exudate, and be graded as 1+ or 2+.
Okay, just a little bit
Then
more.
depress the tongue if necessary, and check the posterior pharyngeal wall. The posterior wall should appear pink and have no exudate or lesions. To test cranial nerve
Can you stick your
12,
tongue out for me,
the
please?
hypoglossal nerve, ask the person to stick out her tongue. It should protrude in the midline and remain there without tremors or deviation.
Now I'm going to take a look at your neck.
For this part of the examination, begin by observing the person's neck in relation to her head. The neck should hold the head erect and still in the midline, and the sternomastoid and trapezius muscles should look symmetrical. Then observe the areas of the salivary, lymph, and thyroid glands, which should not be enlarged. Also check for pulsations. Other than brisk localized pulsations of the carotid artery just below the angle of the jaw, you should see no pulsations.
Okay, now I need to feel your lymph nodes.
To
so I'm
palpate
just
the
going to
lymph
use the pads
nodes,
of my fingers and
use
touch
a
on the
gentle
side of
circular
the neck.
motion with your finger pads. In order, palpate over the preauricular nodes, posterior auricular nodes, occipital nodes, submental nodes, submandibular nodes, jugulodigastric nodes, superficial cervical nodes,
Okay, now turn your head just a little.
deep cervical chain,
Okay, to the other side, please.
posterior cervical nodes,
Now shrug your shoulders for me.
and supraclavicular nodes. If any nodes are
Great,
palpable,
thank you.
note their location, size, shape, borders, mobility, consistency, and tenderness. Normal cervical nodes should feel small, less than 1 centimeter, movable, discrete, soft, and non-tender.
Did you feel any tenderness?
If any nodes are tender or enlarged, check the area they drain for signs of infection, inflammation, or other problems.
Okay, Tiffany, now I just need to feel your trachea. So I'm
Next,
just going to put my
palpate
finger
the
here and
trachea
feel around a
by
little bit.
placing your index finger on the trachea in the sternal notch and sliding it off to each side. The space between the trachea and sternomastoid muscle should be symmetrical on both sides, indicating a midline trachea.
Okay, Tiffany, if you could hold
Prepare
on.
to examine the thyroid
Just going
gland
to shine this
by
light on your
aiming
neck.
tangential lighting across the person's neck and giving her a glass of water.
Get it adjusted. There. Now I'd like you to take a sip of water, tilt your head back a little bit, but don't swallow yet, okay?
To observe the size of the thyroid, have her tip her head back
Okay,
slightly
swallow.
and watch as she swallows a sip of water. You
Okay,
should
one
see
more
the
time,
thyroid tissue move up with each swallow.
All right, you can hang on to the water.
Next,
Turn this
palpate the
left
thyroid
way.
gland from behind.
Now sit up straight.
To do this,
I want you to
have the
tilt your
person
chin
sit
down
up
and to the
straight
right a
with her
little
head
bit.
bent slightly
Like that,
forward
right,
and to the
okay.
right. Use the fingers of your left hand to push the trachea slightly to the right, and curve your right fingers between the trachea and sternomastoid muscle, retracting it slightly.
Now take a drink and swallow,
Then
please.
palpate when the person takes a sip of water. As she swallows, the lobes of the thyroid move up under your fingers with the trachea and larynx.
Please.
Although the lateral lobes normally are not palpable,
Now
you
you can
may
tilt
feel
your
the
chin down to the
isthmus
left
over
side.
the tracheal
We'll
rings.
do the same thing on the other side.
Reverse the
okay?
procedure to palpate for the left side of the thyroid gland.
Drink and swallow, please.
Okay, Amanda, I'm just going to tilt your head down a little and to the right. Good.
In a pregnant woman, the thyroid gland normally may be palpable.
Okay, and take a sip. And swallow.
Now I'd like you to take a deep breath and hold it while I listen.
If the
all right?
thyroid seems enlarged, auscultate for a bruit with the bell of your stethoscope. Normally you hear only breath sounds, but in thyroid enlargement, you may hear the soft, pulsatile whooshing sound of a bruit.
You can breathe. Okay, Tiffany. I think the only thing we found is that you had a little tenderness on the right side of your neck. Have you had a sore throat or anything?
After examining the nose, mouth, throat, and neck, summarize your findings for the person. Then ask if she has any questions. Also, take this opportunity to teach her about self-care and health promotion to improve her health and well-being.
Thank you.